We talked a little bit about the treatment options, but what are some of your favorite therapies to use? Which do you feel is that you find more success with than others, or are there any sort of nuances with the therapeutic options that you use to treat chronic migraine?
Thank you so much, Marco. You're absolutely right. The patients are puzzled. They look through the questionnaire. We talk in the same language. They're eager to start the treatment. Now, what should I start them with? Right? Okay, so what's next? And they're really excited. And again, it all depends what they're coming from. Some will come with completely blank, nothing tried before. And in that point, you are facing the insurance company.
Mm.
Let me tell you one thing, and it's really sad what I'm encountering right now. And again, I don't want to go in politics, but I have to raise that. This is something that needs to be changed. Because if somebody comes and they heard about amazing and innovative therapies, and suddenly you say, but you did not try this,
Yep.
you did not try that, and you know what, the insurance will not approve that if you don't. And they kind of, thinking, wait a second, but I pay those guys. I pay my insurance. Why they have to decide? Aren't you guys having like a special consentment statement? I said, actually, you're absolutely right. And that's, Marco, I'm excited about because I want to bring this in. This year, our American Headache Society reviewed what we have, what options for the treatments we have, and they concluded that the patients are asking and reasoning and thinking and voicing why we not go with migraine specific treatments, and we're going to talk about them, and why we have to bypass them with something that we used in the past without knowing what we're treating exactly. So this is going to change. That's basically my, bright part of this, right now have to do. It's going to change because we entering in a scientific field when you have good statements, wonderful research programs, and amazing support for us to tell the insurer, you know what, this, although it is expensive, for the first time in the history somebody spent money on migraine, it isn't expensive, but it is effective. So it is specific, and that's how you actually can define the migraine, because now we have these pathways behind. So it's going to change, but again, unfortunately, it all depends what patient tried in the past, what patients are, eager to try, and you can encounter different scenarios. If you want, I can guide you a little bit through the scenarios. Imagine a young patient, somebody who is in school and college, and of course, there's so many things that can go wrong when they start with a treatment that they never tried before. Somnolence, mental fog, just as a side effects, gain weight, as just as side effects of some treatment that we offer. And you have to kind of really quickly skip all of this, try and make a note and go through migraine more specific therapies that we're going to discuss. This is one part. So another patients will come and they already tried treatments, as I mentioned before, that have really long list of side effects. But then those will say, well, I tried all this, so that's a freedom for me to try something that they came here specifically because they heard about it. Yep. And then I have those who will say, this is too new. I don't have enough data. I would like to see more longitudinal studies to see what's the safety profile. And although I'm excited to see these new therapies, I'm not still really eager to jump on that. Yep. And by the way, I don't like medications. Do you have anything else? And that's why everything I showed you before, I'm really fond of that as well, because this is a really big category of patients that will go more of a holistic approach, integrative medicine, acupuncture, massage, diet approach, mindfulness, stretching exercises, vitamins, supplements. So this is this kind of category, and then you give them all this electric modulation devices, and they're really happy. Yeah. And then those patients, they say, you know what, I try all of this. Do you have something else? And for this something else, I have an invasive procedures. I do offer onabotulinum toxide A, which was approved for chronic migraine treatment a decade before. So we have really long studies. We have 2 preem studies that showing really good efficacy and tolerability, really low profile of side effects. And patients are receiving that treatment on a quarterly basis. So as you can see, although it is invasive, it is a procedures, this is an injections, it's all anatomical. Okay? You have to know your anatomy to go to these places. And but a lot of patients have really good results. But even Marco, right now, having all these treatments, we're opening a completely different page. And that's what we call an adjunctive therapy. And that's what you have to think when you talk about chronic migraine. Because chronic migraine, sometimes it's not easy to reverse and transform to episodic, although it is possible. I really want to send that message to all the providers. Please don't tell them that's it. Or don't tell them, I don't know what else to do for you. There's a lot of different adjunctive therapies, and we can combine them, we can switch around. And it all depends on the patient trust and how they trust you, because they know you're talking the same language with them. So that's when you open up that questionnaire, that's when you know that you treat exactly what you here to do. And that's why they're really excited to try all this stuff. So again, as you see options and variations, there's not an algorithm that I can give you exactly. It all depends of how young, what's happening with insurances, what they tried before, and specifically their condition, because some can have 4 migraine per month that can last 3 days. And if you trigger and if you point to a really good abortive therapy that will abort that in the first day, that's it. It's only 15 or 30 minutes. Maybe it is 4 times a day, 4 times a year, or 4 times a month. But that's actually going to get better and better, because if you address that inflammation right away and you have really good treatment, you decrease not only that disability for that day, you decrease that activation for the further attacks. So maybe they even have lesser attacks that month. So again, as you see, the treatments, it's not an algorithm, as I mentioned. It's all patient by patient basis. So you have to see the patient, you have to assess the patient, and you have to kind of feel that too. I have this, I call it like a sixth sense, when I see the patient's questionnaire, and then when I encounter the patient, I start talking, I have kind of already this kind of feeling that I think the patient is going to do really well on this treatment, or I think it's going to do, and I think it comes with the experience. Although everybody can develop that experience as you pay attention to what patient is writing or patient is talking to you. If you listen really carefully, if you stay really tuned on that patient profile when they come in, you definitely can ascertain really well different types of treatments.